Okay, so I'm gonna knock on my door. Knock, knock. Hi there, Miss Hale. My name's Kylie. I'll be your nurse today, okay? I'm just gonna wash my hands real fast. So as I'm washing my hands, I'm gonna take a quick look in my room, make sure there's nothing on the floor for her safety. I'm gonna take a quick look at her face and see if she's grimacing, smiling, sad. Um, See if she has fully and kind of dressings I can see on her and any tubes or any lines. So wash my hands. Okay. So what brought you in today? Some bloody diarrhea. Is that normal for you? Okay. Well, I'm just gonna take a quick assessment on you. Okay. Can you tell me your name and date of birth? So as she tells me this, I'm gonna be looking at her wristband. Um, Information is correct. Can you tell me where you're at? Good. And today's date. Excellent. All right. So I'm just gonna have you look over towards your left real fast. Good. And towards me. Good. And no JVD. I'm gonna go down her arm and feel her arm. Her skin is nice, warm, and dry. No edema is present on her upper extremities. I'm gonna check her turgors, which is good, less than 3. I'm gonna feel her radial pulses, which are present bilaterally, regular and strong. Good. I'm gonna check her capillary refills on her hand, good, which are good. Can you squeeze my fingers? Good. And can you pull towards you? Excellent. And push. Good. Can you wiggle your fingers? Excellent. Any numbing or tingling while you do that? Oh, good. So while she's sitting, I'm going to go ahead and take a quick listen to her lungs. So I'm listening to her lungs real fast. All right, good. Listen to her front. Good. I'll listen to your heart real fast. Listen to me here. So her lungs are nice and clear bilaterally, anterior, posteriorly. Apical pulse is present, nice and strong and even. Do you have any cough? No coughing? Okay. I'll listen to your belly real fast. I'm going to start at the right lower quadrant. Good. Up. Good. So her bowels are pretty hyperactive, which she did say she's been having diarrhea today. Go ahead and lay down and feel your belly. Any tenderness? Some tenderness when I touch? All right. So she does have some tenderness in her belly when I touch it. Her belly is nice and soft, but it is a little round, a little tender. Okay. I'm going to go down on her legs. Her legs are also nice and dry and warm. No edema is present. I'm going to feel her pedal pulses. All right, good. I'm going to check her capillary refills, which are good, less than 3. I'm going to have you, can you push down like a gas pedal? Good, and pull up. Excellent. Good. So I would make sure I document in the correct format, time and date. The doctor did order her some dicyclamine, so I'm going to go grab that real fast. All right, I'll be right back, okay? So I'm going to make sure I wash my hands. All right, so knock back on the door. Neither Miss Hale. So the doctor did order you some dicyclamine, which will help with your IBS. It just kind of helps reduce some of that cramping, and it'll help slow down your gut, okay? So hopefully that diarrhea will slow down a little bit. So it is an IM, which I'll have to put it in your arm, okay? So with the IM, I want to make sure that I have at least a 1-inch needle. So my needle is 1 inch, and I'm going to do about 24 gauge. So we need 20 milligrams. So I'm going to make sure I take my alcohol wipe, clean off the top. Take the lid off of this. This is 20 milligrams. We're going to pull up 1 milliliter. Make sure I had to wash my hands too before all this. Cap back on. Okay. like I said, I would make sure my hands were washed, double check the doctor's orders, have her state her name and date of birth again, even though she's in here. I have the dicyclomine at 20 milligrams. So, like it says, an IM, so I'm going to go on her deltoid. So I'm going to do the 2 fingers, maybe 3 fingers, and then go down. So I would go 2 fingers and then the 3rd down. So being the most meaty part of her arm. 2 fingers and go down. So I'll just kind of make right there. I'm going to clean in circular motion, 2 inches out. Alright, I'm going to make sure that she's nice and relaxed. I don't want her to be all tensed up. And with the IMs, you want to make sure that the skin is nice and taut. So I'm going to push back, pull the skin down, and I'm going to stab her at a 90-degree angle, like a dart, real fast. Administer the medication kind of fastly, hold it for a second, and pull it out real fast and let go of the skin. Make sure you don't massage it or anything. Put a band-aid on it. I would document in the correct format the time and date, the medication that I used, the amount that was administered, and the location that I administered it at.